So what I've noticed is there's often quite a difficulty in primary care for identifying left bundle and right bundle branch block. First of all, identifying it. Secondly, differentiating the two traces. And it's important to be able to do this really with minimal effort because the repercussions clinically are actually very different. So what do we mean by left bundle and right bundle branch block? The left bundle is the wire that goes from the AV node to the left ventricle. The right bundle is the wire that goes from the AV node to the right ventricle. Now the right ventricle is much thinner than the left ventricle, so for the wire to be damaged, for some form of block to occur in the right bundle, it's actually much easier. Whereas for the left bundle, which has a much thicker set of wires, because it's supplying a larger muscle mass, for there to be damage there or a form of bundle branch block, that requires more effort, which means there's probably something more sinister going on. There's a higher likelihood of pathology. So again, let's frame this with a case. We've got a 62-year-old with suspected heart failure. Has got exertional breathlessness, has a raised BNP of 450. This is not an NT-pro BNP. This is the old-fashioned BNP, and 450 would very much be elevated, but no chest pain. They have an ECG done, and this ECG shows one very important finding, which is that their QRS complex is clearly very broad. So the take-home point here is to call anything a bundle branch block. The key criteria is that you must have a broad QRS. You can't call something bundle branch block if their QRS duration is narrow. So to call something either left or right bundle branch block, it is absolutely critical to confirm that they've got a QRS duration that is broad, so that's more than 3 small squares. And the way I'd do it is look at the QRS duration at the top of the ECG if it's more than 120 milliseconds. Once you've done that, you know you're halfway there. You've got bundle branch block. And you've just got to figure out, is this left bundle branch block or right bundle branch block? And as I said to you, if you've got left bundle branch block, it's a bigger problem. And as a consequence, if you in primary care have a new finding of left bundle branch block, those patients should routinely be referred to a specialist, a cardiologist, to investigate further, because to find out what the underlying cause is going to require specialist tests. Conversely, if you have someone who has right bundle branch block as a new finding, assuming they're asymptomatic, this can and should be managed in primary care, because all you really need to do is perform an echocardiogram and make sure that you've got a structurally normal heart. And if they're asymptomatic, you tell them they've got right bundle branch block, they've got a structurally normal heart, and no further action is needed. You can't ignore any of these bundle branch blocks, but the take-home message is left bundle branch block is far worse and requires specialist evaluation. Right bundle branch block is still a concern, but those concerns can be largely allayed by having an echocardiogram performed in the community that shows a structurally normal heart. So very simply, left bundle branch block, it's a thumbs down. It's bad news. Right bundle branch block is a relative thumbs up. And that's actually, that thumbs down, thumbs up way of looking at it is critical to unlocking how to differentiate left bundle and right bundle branch block. So first of all, what are the causes of left bundle branch block? So here on the screen, I'm showing you a typical tracing of left bundle branch block where the QRS duration is broad. And as I said to you, the causes are quite significant: coronary artery disease, an acute MI. Now, for an acute MI to cause left bundle branch block, this patient would be in cardiogenic shock. So you're not going to see an acute MI in primary care as a cause of your left bundle branch block. But also aortic valve disease, aortic root disease, potentially chronic uncontrolled hypertension. And on this slide, I'd like you to look at V1 and look at the QRS. And you'll notice that the QRS is pointing downwards, so almost like a thumbs down. And that's really the key of unlocking it. You've got a broad QRS, and in V1, your QRS is pointing downwards. So that's a bad thing, and I'd call this left bundle branch block. From an electrical viewpoint, what happens in left bundle branch block is the wire on the left side of the heart going to the left ventricle is effectively severed. So the electricity has to go down the right bundle and then make its way across transversely to the left ventricle, causing that delay, that QRS duration broadening. And you can see the characteristic changes in V1 and V5 on the slide. You can talk about William and Marrow. I think that's a waste of time and never helps. So just use the system I'm suggesting in this video. Now, conversely, in this ECG, you have someone with a broad QRS, very clearly seen in V1 to V3. The QRS duration here is 140 milliseconds. But actually, what you're seeing, if you look at V1, is the QRS duration is pointing up. Okay, so that's a thumbs up. And this is right bundle branch block. And it's often seen in patients with no underlying structural heart disease. You get what we call an RSR pattern, where you get an initial upstroke, a downstroke, which is your S wave, then a big upstroke, which is your R wave, an RSR pattern. But the key take-home message is that the QRS duration should be pointing upwards. And this is what we see. Conversely, in terms of the electrical issue, the right bundle is severed. Electricity has to go down the left ventricle and then make its way across to the right ventricle, causing that broadening of the QRS. And what we see in lead V1 is this classic RSR pattern, where you get an upward stroke, a downward stroke, and a big upward stroke. So the second R wave is much bigger, and overall the QRS complex looks like it's pointing upwards. So let's look at this ECG tracing. Someone with quite profound bradycardia with a broad QRS. Clearly they've got a bundle branch block because they've got a broad QRS. The question is it left or right? And if you focus on V1 and ask yourself, is the QRS pointing downwards or upwards? It's clearly pointing downwards. Clearly pointing downwards. So this is left bundle branch block. And that means thumbs down. The other way of looking at this, if you rotate this ECG 90 degrees clockwise, and look at the QRS complex in lead V1 and rotate it 90 degrees clockwise, you will see that the QRS complex is pointing to the left. So that's another way of stating this is left bundle branch block. Now conversely, in this ECG, you've got a QRS duration that's a bit broad. Let's say it's 130 milliseconds. The QRS duration is, the QRS is pointing upwards, and there's a classic RSR pattern if you look closely at V1. And this is thumbs up. This is right bundle branch block. Equally, you can rotate the ECG 90 degrees clockwise, and you can see that there is the ECG complexes are pointing to the right. So I'm going to now show you some ECGs here. So the question you've got to ask yourself, just think out to yourself, and I'll tell you as we go along, is this left bundle or right bundle? And to answer that, you've got to ask yourself, is it thumbs down in V1 or thumbs up in V1? So here we go. First tracing, left or right? Let's give you a bit of time here. So the QRS is clearly pointing down in V1. This is left bundle branch block. Left or right? Similarly, this is left bundle branch block. Left or right? Now look at the QRS here in V1. It's pointing upwards. That's a thumbs up. This is right bundle branch block. Again, the QRS is pointing upwards. This is right bundle branch block. Right, I'm not going to say any more for the rest of these ECGs. I'm just going to let you at home look at them and ask yourself, is this left or right? And if you don't quite get it right, start the video again and have another go. So is this left or right bundle branch block? It's up to you to decide. Left or right bundle branch block? 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 Now I'm going to stop you here. If you said left or right, then you've got to look at it again. In this ECG, the QRS is narrow, so there is no bundle branch block. So there is no bundle branch block. This is a narrow QRS. So you've got to make sure that if you're calling it left or right, you have to have a broad QRS to start with.